With each passing moment, the Olympic Games inch closer. Already delayed a year because of the pandemic, for volunteer Barbara Holtis, this is not the Olympic experience she signed up for.
It was supposed to be this fun experience in your life, a once-in-a-lifetime experience, but now it's just a really dangerous experience.
With 100 days to go, Tokyo and several other prefectures are again enforcing antivirus measures as Japan faces a potential fourth wave of infection.
We can't even yet imagine how bad it could be.
Holtis, deputy director of the German Institute for Japanese Studies at Sophia University, co-edited a book on these games. She has serious concerns for her health and safety.
They give us masks and they give us the hand sanitizer, but we are told, keep washing your hands, do social distancing, do measure your temperature, do distance yourself from your family during the time you volunteer. But it is all on us.
That's okay with volunteer Philbert Ono. He's eager to help athletes inside the Olympic Village. He says he hasn't been told much beyond that.
It's probably because the organizer doesn't know what the conditions will be 3 months from now. They can't predict the future.
This is the Olympic Village where tens of thousands of athletes, trainers, and officials will be staying during the games. And while their movement will be tracked, volunteers working here will be able to go in and out daily. And medical experts say it's a recipe for disaster. Dr. Hideaki Oka, an infectious disease expert, says as safety measures stand now, there's a high chance Tokyo 2020 turns into an Olympic-sized superspreader event.
There is enough of a possibility due to the mutated virus. Those variants all have similar points, but are also making little mutations in South Africa, the United States, Brazil, Japan, and various other places. All of them will get together in Japan. Then there is a concern that the new virus from there may spread all over the world.
With participants coming from roughly 200 countries, Oka says changes need to be made now. Movements must be restricted, testing improved, and vaccines mandatory. To date, Olympic organizers have delayed the Games 1 year, barred spectators from overseas, and created COVID-19 safety playbooks. But for now, vaccines are not required for participants. And with less than 1% of Japan's population fully vaccinated, it would appear unlikely participants and volunteers will be vaccinated by the start of the Games.
As an infectious disease specialist, I cannot approve holding the Games in a situation where not enough vaccinations have been made and enough countermeasures put in place.
Olympic organizers say they're updating their COVID-19 playbooks later this month. While they say they hope the vaccines will soon be available at home and abroad, they are preparing to hold a safe and secure Games with or without vaccines. Blake Essig, CNN, Tokyo.